Okay, now we're going to get into our individual types of stim. So by now you should have had experience with the electrical currents, understanding the electrical background, should have an idea of how you would place electrodes. In class, you should have played around a little bit with kind of looking at the machines and understanding the machines. And now we're going to specifically talk about the different types of stim we can produce in order to get the different physiological effects that we want. One of the most important things you need to know before you start playing around with the eStim and setting these things up is knowing what are called the contraindications and the precautions for electrotherapy. So these are the general ones that your book talks about. We'll mention some of these and some other ones, but these would be reasons you would not want to do eStim on someone. Okay, so if they have a cardiac disability, we especially would not want to stimulate the thorax or the neck because that can disrupt normal respiratory or cardiac function. If they have pacemaker, okay, the electrode placement, especially if it's in where the current flows for the pacemaker, could affect their pacemaker. So we would never want to do that, especially up in the chest area. If they have arterial disease, by putting this current through, we could get pain or exacerbate their ischemia, right? So those lack of oxygen. If they're bleeding, uncontrolled hemorrhages, the electrical stimulation could increase the amount of blood loss. Sites of an infection. Basically, in those areas of an infection, we would not want to facilitate the growth of those either bacteria or virus or whatever might be in there. There's exceptions to that when you're using the wound care protocols that we'll potentially talk about, but for the most part, it can just contaminate things, and we wouldn't want to kind of facilitate its growth. Blood clots. We don't want to do eStim over any blood clot areas like DVTs, because especially if we end up creating the muscle contraction type of stim, that could dislodge that clot and it could go up to the lungs or the heart. Pregnancy. Pregnancy will end up being a contraindication for almost all of our modalities. And it's because we don't know what happens to the fetus when we apply these modalities to them. So if you're going to work with a pregnant woman, we almost never do the abdomen, the lumbar, or the pelvic region. And if you're going to do it in other areas, they should have a conversation with their physician about that and if it's needed. Any cancers. The current could possibly increase the growth or the spread of the cancer, so we don't want to do that. Any exposed metal implants. So contact with like a rod that's actually exposed would be a problem. Usually you can apply over metal implants that are into the body and you won't have any problems. But if the metal's actually out or if there's staples, then we don't want to put the pads and the current flow directly over those areas. History of seizures. This is especially true with our high volt pulse stimulation. That if they have seizures, if we stimulate the head or the neck area especially, that can trigger a seizure in them. Any sensory or mental impairments. Basically, if the patient can't tell you what they're feeling as you're turning up the intensity of the instrument, or if they can't tell you if something feels wrong, we don't want to be doing treatment over those areas. So whether it's a condition or whether maybe they've been anesthetized from surgery, we would not want to do stim over those areas because they can't give us feedback. And then any unstable fractures. Motor level stimulation would stress those tissues, especially if we do muscle contraction, that would stress those tissues and we want those to heal. Some precautions. Menstruation. So there's a couple studies or like not studies, but like cases of there being an increased amount of menstrual bleeding if you use eStim in the abdomen, lumbar, pelvic. It's kind of mixed results on that, but it's something you'd want to ask your patient and see that they are okay with. Areas of nerve sensitivity. So areas where nerves are really highly sensitive, especially those that then regulate important parts of our body. So the esophagus, the larynx, the carotid sinus, the upper thorax, the temporal region, in or around the eyes, things like that. Unfused epithelial plates. So if they have open growth plates, you just want to be careful in those areas. Again, maybe talk to the physician. If they have communication impairments, again, if they can't give you feedback, that could be unsafe. If there's severe obesity, we might have too much insulation, so the stimulation might not be effective. Um, it could also cause some irritation if the pads have to be worn for a long period of time. And then the electronic monitoring equipment. So if they're also wearing an ECG or something like that, we don't want to use e-stim at that same place.